today we have Sarah from Sarah Breslin Wellness. So tell us a little bit about yourself.
So I'm from Maynooth originally. I've lived at various places all over the world, but I'm back home in Maynooth now, probably about 14 years after my mom passed away.
Okay.
I've been a massage therapist for 26 years now, which I can't believe I'm
God.
saying that.
Yeah.
And then I've been doing colonics for about 13 years.
Brilliant, really good. And you're based in Maynooth, aren't you?
Based in Maynooth, we're in the Maynooth Business Campus.
Okay.
So I started off in a little treatment room that a friend rented out to me, moved back to the house, working on my own.
Yeah.
And now we have 4 rooms up in the business campus, and I have 4 girls part-time, and we have a couple of therapists who rent the room.
Yeah, I was at the clinic myself, and it's really, really lovely. And it's so, like, you do a few different treatments, don't you?
Yeah.
Okay, brilliant. So lymphatic massage.
Lymphatic drainage is a big one on the massage side. We do offer like holistic massage with the cupping massage as well. Andriana does that too. And then we have the colon hydrotherapy, and we've recently taken on board a new device called the exilis, which is for skin tightening, fat reduction and vaginal rejuvenation.
Very good. So who can benefit from the exilis treatment?
So there's 2 parts to the exilis device. So the first, the one I'm really keen for people to know about is the vaginal rejuvenation one, because it kind of resolves a lot of problem for women that's not known about, not talked about, and they don't know there's a solution available there. So the reason for doing the vaginal is, for me, the reason I took it on board was the bladder leakage, which so many of us have an issue with, and
some women, I think, just do it
and don't tell anybody.
Yeah, exactly. Yeah, I know.
Decades they go without telling people, or mention it to anybody, and they're just buying pads all the time.
They think it's just a thing that happens.
Oh, that's aging. I have to put up with it. And it does stop you from doing
Of
things.
course,
So with the exilis, we put a little probe in, and it stimulates collagen production in the vaginal walls. And it's the structure of the vaginal walls that help to stabilize the urethra and the bladder. So that's where they get the strength from, so that they're not leaking. So by doing that, we can prevent or reduce dramatically the bladder leakage.
Very good. And the Vagifem, so with women that use Vagifem, could they get this done as well?
Oh yeah,
it would be just great combination.
Just in addition, like if they find like they're getting good results but there's still issues, then this would be a great way to just kind of top it up completely, you know.
Brilliant.
Like I had it done myself. That's the reason I took it on, because I was having.
And is it sore to get it done, or is
not
it not
It's just a lovely, nice, warm feeling.
Yes, okay.
And there's no downtime. You just get it done, off you go. You don't have to be worrying about using any products or not being active or anything. Just off you go, do your thing.
Brilliant.
And so we normally have 3 treatments, and some people it might take 6, but we start with 3. And like after the first treatment, everybody has seen an improvement. We try and get them within 7 to 10 days, because that's when you get the best results. But the results continue to improve over the months. Like I was probably 2 months later, and I was going, oh my God, that's even better now, you know. So
it does make a difference. That's brilliant.
And then the only thing is, because it is stimulating collagen, you do have to do it annually. You know, collagen production tapers off again.
So that's something that you do.
So you would do it once a year, maybe have your 3 treatments again. So, but like, absolute game changer. But it also helps with recurrent thrush, with dryness, irritation, and laxity. You know, so like. Pregnant women, postpartum.
Very good.
There's a lot of laxity there, you know. You're just going, like, it's all just hanging out.
You
know, like relationships can suffer and all that kind of thing. So it's really
great to have it. It's really that you do lymphatic drainage massage. So what does that do?
So lymph drainage is moving fluid that collects in the lymphatic system to the body. So it's mostly supposed to flow like a water-like solution, and actually drains from the bottom up into the collarbones here. So sometimes, especially with inflammation, you've been through trauma, you've had surgery, you've had treatments, it can get stuck in different places. So the lymphatic drainage can help support it to remember how to go, or help find a new pathway. So if you've had scarring, especially like C-sections or you know, implants or reductions or any of those kind of things, any surgery, hip, knee, anything, then the lymph can get stuck in those places. So we need to help direct it to a different way, so it can still drain into the same area, but just support it. It's really light touch. The lymph drainage we do is really light touch.
I've got it done with you before. It's lovely, really nice.
And it's very subtle and soft. And like, I had a new client in recently, and she's just delighted, because she's been so heavy and bloated and sore to touch.
Yeah.
So she's never been able to enjoy having a massage.
Yeah,
And
okay.
now she's enjoying her lymph
Enjoying it.
drainage, and she's able to relax and, you know, get the benefits of that side of it as
Very
well.
good.
So yeah, it's to support the lymph, and the lymph collects bacteria, viruses,
Yeah.
toxins. So you don't want any of that just hanging around.
Hanging
in the
around,
system.
yeah. So it'd be good for would it be good for period pains or like, you know, endometriosis, something like that, it would help all those.
Yeah, exactly. And again, because it's so subtle and gentle, it's not going to trigger any flare-ups.
Yes, okay.
In somebody who has an inflammatory response like endometriosis or anything like that. You're not going to end up with an episode after it.
Yeah.
And it's really slow. Like, we never get a full body treatment done necessarily, because we have to leave time for the lymph to actually drain as we're moving it. So it's just wonderful, and I think nearly everybody can benefit from it.
Yes, I think so, yeah.
I've treated people who were immediately out of surgery. I've treated people because I have cancer care training, and I've treated people on their cancer journey. Like post knee op surgery. Like, I fully believe everybody who's been given a C-section, is prepping for a C-section, lymph drainage immediately, as soon as you possibly can. Like, it really helps that tummy area, you know, and it doesn't settle there then.
And is it something you have to get done once, or do you do it a few times to kind of see a, you know, a benefit?
It'd be like for a maintenance thing, we would say once a month.
I suppose how you feel. It's
Yeah,
how you feel.
exactly. And it's how long there's been an issue.
Yes.
You know, like if you're just after having surgery or a C-section, you know, you're getting on top of it quickly. But we normally say have 3 sessions as close together as you can.
Yeah.
Like maybe a week, 2 weeks
That
apart.
makes sense, yeah.
Just get on top of it.
Yeah.
And then you can do maintenance.
Very good.
For people who come in post tummy tucks or, you know, cosmetic surgery things, we normally do 6 sessions every week for 6 weeks to really make sure that the body is not holding on to the fluids after the surgery. So.
And you were also mentioned about the colonic. So why, let's say, would I need one? Why would I need to get one?
Well, I just think, again, a bit like lymph drainage, everybody can benefit from colonics. So we have like a top list of things that the benefits of colonic. So one of the big ones is hydration. Because we're adding a lot of water directly into the colon, and the colon's job is to absorb fluid and water, so that can rehydrate the body. So I think that's a top issue people have. Life is stressful, inflammation triggers, you always need a bit of hydration. And also it helps to get those bowel muscles to make sure they're working, because they get triggered and stimulated when we're doing the colonic. So if there's any parts that are gone spasm or sluggish or not fully firing, it really gets them to work.
As you were saying to me before, you kind of have to poo twice a day, don't you? Really? Yeah.
Like if you're eating 3 meals, and especially if you're like, this is funny, I always think people who eat really well, but only go once a day, can still be really constipated, because they actually are eating so much good fibre and foods.
Yes,
they actually should be doing the 2 to 3.
Yes, I know what you mean.
Without even having an issue with it, you know. So it's really great for just resetting the body as well. You know, sometimes people are caught in this loop. Like a lot of people, they have to use laxatives. Then they get dehydrated because they have diarrhea as a result of the laxatives. So now they've lost electrolytes. So now they're dehydrated again. So now they get constipated again. So it's just this vicious circle they're caught in. So it's a really great way to interrupt that, get the body fully rehydrated, get it back on track, get the body responding, and not just like overwhelm happening all the time, just overstimulated. So constipation obviously is a major issue. And then a lot of people have like diarrhea, like they might eat something and they've thrown straight to the toilet. Quite often that's actually constipation. Because their body is trying to get rid of something. So they will get rid of the liquid, because that's what it's able to do, but there's a lot of solid congestion in there as well. So it's really great to clear that. And like the thing about it is, our lymphatic system is connected to our digestive system. So if the organs are all clogged up in the abdominal digestive system, then our lymphatics are congested, so you're going to get that bloating and heaviness as well. And the lymph that's collected from the digestive system actually has some fat content in it, and that's what helps to distribute our hormones. So you know, exactly. You could be having hormonal issues and digestive issues, and it could be interlinked.
It's just interlinked. That's amazing. Because I know that you probably get the question, is it sore? I got it done now, and I didn't feel it was sore. It was just, you know, how you feel like you're going to the toilet kind of when you're getting it done, don't you? But I found it fine. I felt actually felt afterwards relief, that kind of relief feeling. It was really
a lightness to you.
A lightness, exactly.
Because most people, like, you leave for Ireland nearly afterwards. Because it just removes so much fluid, it just starts to flow. And a lot of people have a great sleep
Mm.
because we've put them into rest and digest mode. We've switched off fight and flight. It sedates the nervous system, especially if we use our compressor with the cups, because that has a little bit of a vibration going on, and that really sedates the nervous system. So, and that's great because when you're relaxed, all your vessels, you know, your lymph, your blood, your veins, everything dilates, so more flow happens then. And you know, body fluids can get to where they're supposed to get to because we're not all clamped up like this. So it even can remove congestion in places, even if we haven't worked on it. You know, I've often had people, and we've been working on the chest area, and they go out and they say, God, you look great, your face looks great, because once you live in one place, it moves everywhere. It all starts to flow, you know.
Well, that's absolutely amazing. So I'm going to put the link of your website under here so that anyone can reach out to you that way.
Brilliant.
And you're on Instagram as well, aren't you?
Yeah, I'm not great on Instagram, but I'm there. You can still contact me.
Yeah,
The website is the best way to get in touch with us.
Absolutely perfect.
So,
Thank you so much for coming.
Thank you very much, Jen.